Lipedema. Have you heard of it? Maybe not, but you're about to.
There you go.
I'm Dr. Paul Zalzo.
I'm Dr. Brad Weening. Welcome to Talking with Docs. We brought in an expert, Dr. John Chuback, cardiovascular surgeon from New Jersey. Thanks for joining us again, John.
Was your flight okay coming in from New York? There was a while there where all the flights were kind of getting canceled coming out of New York.
Coming out is okay generally. It's going back to Newark where we seem to have the problem.
Oh,
I don't know
really?
if they have anybody in the tower directing traffic, but we had a smooth flight and I appreciate the invitation.
Maybe they're getting their lipedema treated. Let's learn about lipedema.
Okay, so the first thing, John, would you say is we want to distinguish the difference between lipedema, lymphedema, and just obesity.
Yeah, well, it can be confusing just based on the words and the pronunciation of the words.
The words, for God's sake, lipedema and lymphedema. We have a whole host of Greek and Latin words, and we couldn't pick two more closely sounding words than lipedema and lymphedema.
Yeah, and many people pronounce, not that this is wrong, but lipedema is sometimes pronounced lipedema, which sounds even more like lymphedema.
Yeah.
So lipedema, lymphedema, lipedema.
I thought lipedema was just big lips. I was wrong.
Yeah, it's after a bee sting or something like that. It can happen.
Yeah.
But lymphedema is a problem with the lymphatic system.
Okay.
We have primary and secondary lymphedema. We talked about this in a previous video.
Yeah.
But basically, that's where the lymphatic channels are not functioning properly to remove or wick away or sump away the excess fluid that builds up in the soft tissues. Lipedema is, to make it a little bit more complicated, is something completely different, but there can be overlap with lymphedema as well. Lipedema generally is a fat disorder, and we believe that it is genetically transmitted. Okay. There is no specific gene for it right now. We believe that there's probably a polygenic kind of source to this disease process, but we definitely see it running in families. For somebody like myself who sees a lot of lipedema patients in the office and lymphedema patients, you can see the difference between them right off the bat, and you can see where there's an overlap right off the bat if you are highly experienced. The lipedema patient has a general shape that many times you'll find their mom, their sister, their grandmother, their aunt has that in the family. The first thing to know is that men essentially never get this. Right. So it would be very uncommon to see a man with lipedema. So that rules out half of those diagnoses. Those people are probably either with lymphedema or obesity, et cetera. You can pretty much say that safely. Right. So you're looking at your female population, and when they come in, they have basically a very typical phenotype, meaning their body morphology, their shape is diagnostic of the problem.
Right.
And basically getting into that a little bit, there are 5 types of lipedema, and it has to do with where the fatty tissue is being abnormally deposited.
Okay.
Type 1 is generally described as being from the navel down to the hip and buttock area. That would be a type 1 patient. And type 1s can also be just hip and buttock, sparing the navel. Sometimes the abdomen is nice and flat, and these patients can be quite little in the middle, in the torso section. So think type 1, hip and buttocks. Type 2, extending from the hip and buttocks down to the knee. Type 3, going from the hip and buttocks past the knee all the way to the ankle, but critically important, sparing the foot not involved. Type 4 is from the shoulder to the wrist, more commonly shoulder to elbow, but the type 4 is where the arm is involved, and again, critically important, sparing the hand. Right. So with lipedema, one of the classical signs, especially as it becomes more advanced, is what we call cuffing at the wrists or the ankles, where it almost looks like a child's baby doll toy, where there's kind of, it almost looks like there's a rubber band around
like those balloon
wrist.
animals almost.
Exactly, where you see that twisted appearance and a really sharp cutoff before the hand or before the foot.
Right.
That cuffing appearance is classic. And then there's type 5, which is extremely rare, which is only knee down. only knee down. So those are the 5 types of lipedema.
Okay, yeah. So
Oh, that's-
unlike other
okay.
classification systems where types are in progression, these are just types that are different, recognized patterns.
Yeah, I think you could think of at least 1 through 3
As
as
a
a
progression.
progression,
Right.
Okay.
kind of going down. But 4 is something different, and you can have only arms, or you can have arms with lower extremity involvement. The one that's, again, a standalone is the type 5, which is very rare, but can be very disturbing for people, especially young women
Right.
after puberty, when suddenly the leg from the knee down really takes on a lot of fatty tissue and becomes more of what we call a column-shaped or a rectangular shape rather than the nice tapered graduated shape to the ankle.
Right.
And are the recognition of these types the main way that you can distinguish this from obesity?
Yeah, this pattern of fat distribution, we put this now in this area of disease that is emerging called fat disorders. Generally the trunk and abdomen are spared. So that's kind of the first thing that you see, is you'll see a lady with sort of a bigger backside, hips, saddlebag area, and sometimes, again, the heavy arms. Lots of us have had these kind of people in the family and so on, and we just thought Aunt Marge was heavy or whatever.
Sure.
But you can see that the central portion is spared. They're
Yep.
not really obese in that area, although they may have an elevated BMI.
Mhm.
Often they'll have an elevated
For sure.
BMI because of all this abnormally deposited fatty tissue. But it is a diagnosis where, you look at it, and if you're trained and you're knowledgeable, you should be able to make that clinical diagnosis just by looking.
Now you mentioned it's primarily women, and that it's specifically related to estrogen. So they've shown that it happens typically around puberty, pregnancy, menopause. So these play specific roles, not 100%, but estrogen seems to be the definitive kind of difference between men and women when it comes to this pathology. Is that fair to say?
Yeah, you do see. It's very rare to have it before the first period,
Right.
and sometimes that change with that first period in a young woman, which is a difficult period of time. There are a lot of changes going on, hormonal changes, which can affect the body in many ways. And now suddenly, oops, like for the first time, my butt, my thighs, my leg from the knee down is suddenly expanding, tremendously in size in a very short period of time. So yeah, the hormonal change is definitely linked.
And people are like, well, I haven't changed what I'm eating. I haven't stopped exercising. And I think the other thing that's really important is that it's symmetrical. So it's both legs or both arms. It's not one or the other. Like lymphedema often can be one leg related to, say, a DVT or something like that, but usually lipedema is symmetrical. Is that true?
Exactly. Very important to know that. They're very much symmetrical. And if you do have one limb that suddenly gets bigger than another limb, that's something that you have to have looked into to make sure you don't have a blood clot in that leg. Or it could be, as you said, lymphedema from traumatic injury, all kinds of problems. But lipedema is symmetrical bilaterally.
Okay, so now obesity, which can be managed often or sometimes by activity modifications, diet, and possibly medical interventions, like the GLP-1s and all the newer interventions, and those can be effective for treating obesity. What about lipedema? Do those treatments work at all for lipedema?
The answer is yes, they do, but one of the things that is well known about lipedema is that the fat appears to respond differently. It's not that it doesn't respond at all, but it's more stubborn.
Yes.
And it doesn't want to leave those affected areas. So for example, let's say you have a patient who has lipedema, let's say it's a type 2 with thigh, hip, and buttock involvement, and they're really quite pronounced. And some of these women, unfortunately, can be quite disfiguring. I mean, it can be a dramatic, disproportional deposition of this fatty tissue.
Right.
If they were to lose, let's say, 10 or 15 pounds, they will get a bit smaller in that area, but the disproportionality is what doesn't really change.
Right.
And then you get so kind of tiny in your core and your arms and so forth, and people really struggle to try to get that weight off in one place. And as we know as doctors, spot fat reduction is not something that's a real reality.
Right.
Okay.
I think that's a great point. And another thing about that too is that, yeah, so diet and exercise, it's a little more refractory to that. And that this fat's a little bit different, right? People can be very sensitive. Their skin can be very sensitive. They're more typical bruising because of the microvascular structure there. It's a very unique kind of fat.
Yeah.
Like you said, sometimes it'll scar down. It'll look a little bit different.
Yeah, and it's, again, we talk so much about all these pro-inflammatory states. It's clearly an inflammatory state. The patients, I just saw one patient in New Jersey just before leaving for the first time. She happened to be a physician. Bruising everywhere, very tender to touch, can sometimes be associated with other connective tissue disorders like Ehlers-Danlos and things like that.
Okay.
So we know that something is going on there, and that's why we think there are numerous genes involved. They tend to be hyperflexible. It's not mandatory, but oftentimes can be hyperflexible, and that just normal touching. Sometimes the patients will say, well, my husband gives me a hug and it feels like he's crunching me or crushing me.
Yeah.
And
Like saying, don't hug me?
well, it can
Sometimes
be
my wife says that.
yeah, that's a different subject. But but they really are very, very sensitive in many cases. And then there can also be nodularity,
Right.
which is another focus. So we talked about the types. This is actually kind of an interesting subject for lipedema because there are types, those stages 1 through 5, and then types 1 through 5,
yeah.
and then there are also stages. And the stages of lipedema can actually go from, depending on what staging system you look at, but the most comprehensive one would be 0 through 4. 0 would be that you don't see any physical change in the patient, but the patient begins to complain of heaviness, achiness, sensitivity, but no physical change. That would be considered a type 0. Type 1, the fatty tissue is now enlarged. You're seeing that abnormal deposition in those various areas that we discussed, but tends to be smooth, nice and smooth. The appearance is almost perfectly normal. It can be perfectly normal. Now, on light palpation, in examining the patient, you might find what they call like a feeling of Rice Krispies under the skin, or little foam beads under the skin, tiny little irregularities that you begin to notice. In stage 2, that becomes more pronounced, and the tissue can begin to take on an abnormal surface pattern that they kind of talk about, like a mattress pattern or a cellulitic kind of pattern.
Right.
And then in stage 3, it can become very severe with lobule formation and tremendous disfigurement with big nodules, even something called Derkham's disease. There was a related problem with big lipomas, especially in the upper leg and the upper arm. And then type 4 disease would be lipedema with lymphedema. So those are the stage 4 disease, I should say. Staging and typing, 2 different things related to lipedema.
Okay, so we mentioned that the traditional treatment for obesity, such as weight, calorie intake management, exercise, and possibly pharmaceuticals, don't work so great for lipedema.
Right. Let me jump in right there, Paul, about one thing. The pharmaceuticals, they're taking a very, very close look at this right now. A lot of studies being done.
GLP-1s?
Yeah.
Yeah.
And a lot of early data is conflicting. Some saying it is not doing all that much for lipedema patients, not as much as normal patients with obesity and diabetes, and others saying that they are having good results. So the jury is still out on that one.
Okay, that's like semaglutide, Ozempic, Wegovy, those kind of medications. All right. So then what if any, are there any treatments for lipedema?
There are a lot of treatments. Most of the treatments, I would say, are symptomatic, but this can be a very frustrating
For sure.
disease
And debilitating.
process. Yeah.
Yeah.
And especially for guys like us who are surgeons who like that immediate gratification of going in, fixing something, making it better, and being the hero when everything goes great. But interestingly, again, here's where it gets a little bit confusing for people. Here's where we start to see an overlap between lymphedema and lipedema again.
Okay.
A lot of the treatments are the same.
Yeah, I saw that.
Compression, therapy, graduated compression, hands-on manual lymphatic drainage, decongestive therapy.
Despite the sensitivity too, which must be a little bit complicated, right? Telling you, I got to rub your leg to kind of milk some of this fluid out,
Right.
but you have sensitive skin.
Exactly. And interestingly, again, in that manual lymphatic drainage techniques, now there are varying schools of thought here, but some of them are very light touch.
Okay.
Very light touch meant to stimulate the lymphatics, so they can tolerate that quite well, generally speaking. So compression, manual lymphatic drainage, hands-on techniques, elevation, weight loss, diet. Big thing that gets a lot of, you're probably going to guess.
I was going to say anti-inflammatory diet,
I knew you would
as
say
well,
that.
as well as supplements, right?
Oh,
And we've
Right.
talked before. You have a supplement that you have a company that's involved with flavonoids. So
Exactly.
does that play a role for lipedema?
Absolutely. From a symptomatic point of view and supporting the lymphatic system and supporting lymphatic drainage and flow, the micronized purified flavonoid fraction, the MPFF, is great. And selenium, vitamin D3, all of these anti-inflammatory elements have been shown to be helpful in supporting that lymphatic system and managing symptoms in these people. So those are the big things. And people talk about, now again, lots of different schools of thought. The data is not hard and fast, but ketogenic diet, low carb diet, and anti-inflammatory diet.
Right.
On compression, the guy or gal that developed Spanx must have been onto something.
I think the Kardashians bought that, didn't they? I think
they?
Kim
It's
Kardashian
all
is somehow
compression,
involved
isn't
with that. Yeah.
It is, but again, we
It's
want.
therapeutic, not just fashionable.
But remember, these guys love to joke around. But remember, graduated compression
Right.
is really important.
Yeah.
So
They need a graduated
regular,
Spanx.
right? Exactly. A regular Spanx garment, which is tight and compressive and can be shaping,
Yeah.
is not giving you that graduated compression. But many patients, all joking aside, will use good graduated compression garments. Even we talked about in the past knee high and thigh high, but there are also full pantyhose.
Yeah.
Sure.
And those can be not only therapeutic for symptomatic relief, increasing lymphatic flow, but also for shaping.
Yeah, Brad ordered a pair of those on Amazon.
That's
They come in tomorrow.
okay. Surgically, I've read that liposuction is potentially an option for some of these people. What are your thoughts on liposuction? And obviously, it's expensive. It has the inherent risks of surgery. And people that are desperate, just like anything within medicine, if you have enough desperation, people will do whatever someone tells them might work. For the average viewer who's considering this, is there evidence for it? Is it safe? Does it work?
Yeah, I think that there is evidence for it. It does work. I think that it can be, it can have variable results.
Sure.
Again, we know from back in our surgical training days when we were all rotating on lots of different services, one of the things that we had experience with was the plastic surgical surface.
Right.
And plastic surgery is like any other field of surgery. It's a big responsibility. It needs to be done professionally and ethically.
Yeah.
And one of the big things for plastic surgeons historically in getting good liposuction results is proper, like any other surgeon, proper patient selection.
Yeah.
So liposuction is not a treatment for obesity. That's number one. We know that. Liposuction has always been more of a contouring and shaping modality. So when you get into some of these patients with mild to moderate disease, it might be a very rewarding experience for the patient. When you get into more severe disease, I've had some patients travel as far as Spain, Germany, et cetera, for these kinds of procedures. The results can be less rewarding because there's just so much adipose tissue, fat tissue, that there's not such a dramatic change in the shape of the patient or how they feel physically. So it has to be done in the right hands, somebody with a lot of experience taking care of lipedema patients, and somebody who's very ethical and knows what they're doing. But it is definitely a modality.
And I think I read per session you can only remove about 5 liters, which is just over 10 pounds. So someone that's maybe dealing with more significant disease, it's not going to make as much of a visible difference, which is probably the main reason that a lot of people are looking for this.
Yeah, and people do, again, surgeons vary from surgeon to surgeon, their experience, et cetera. People can get hyper aggressive with this
Sure.
stuff.
Mhm.
And one of the things that's very common, though, especially because of the different body areas, the volume of tissue that needs to be removed, some patients that I have had who've been taken care of by very reputable, internationally recognized experts, they're going for 4, 5, 6 sessions
Mhm.
spaced over the course of a year, maybe a year and a half, 2 years.
Right.
So it's a big undertaking
Yeah.
when they do that.
Not to mention risks. We're not going to go into the
No.
details of liposuction in this video, maybe another video, but anytime there's a surgical intervention, there's always risks associated
Yeah.
with
Sure.
it. And death is one of those risks as well.
For sure.
Yeah.
One other thing I'll mention about surgery, there is another form of surgery, typically reserved for more advanced cases where you have real disfigurement with lobules. And these lobules can be very, very dramatic looking. I mean, really pronounced and disfiguring. So there are these debulking surgeries where sometimes plastic surgeons especially will do fairly aggressive surgery, excising, literally excising those big hanging lobules and then closing the skin with suture and so forth.
Right.
So that can be very, very rewarding for patients, but again, it has to be done in the right hands.
Full-on open procedures.
Correct.
Yeah.
Wow. There you go. I bet you there's a lot of people who did not know about lipedema.
They probably just thought it was lymphedema, to be honest with you. I think.
Or obesity.
Or obesity, yeah.
Right?
Yeah.
And we're
And
even-
one other point on that, there is definitely an overlap between
Right.
these
Yeah.
3 entities, lymphedema, lipedema, which we call lympholipedema,
Mhm.
and lymphedema, lipedema, and venous insufficiency, which we call phlebolympholipedema.
Right. Of
So,
course you do.
so yeah, we have to because that's what it's called.
Yeah.
Well,
Because you ran out of Latin words.
yeah, you got to show off.
Yeah.
Don't ask me to spell it.
Yeah.
But the point is, sometimes it requires. Well, here's a good point as I think we're come to wrapping up. These patients require multi-modality care with a group of professionals.
Right.
It can include nutritionists, dietitians, physical therapists, psychologists, surgeons, vascular specialists, venous specialists, etc. This patient population is really suffering in a lot of ways and are very difficult to manage and care for, but they deserve great management and care. So if you're one of those people, the doctors always say, be your own best advocate. Do everything in your power to build a great team of clinicians around you. One doctor, your primary care doctor, your dermatologist, one physician is not going to be adequate in what's a big, big battle.
You need a team. And like we always say, you are in charge of your own health.
Now you know you got the A to Z on lipedema. If you like this video, please like it, subscribe to our channel, share it with someone that you think could benefit from this information.
Dr. Chuback, once again, thank you so much for your expertise.
Thanks, guys. It's a pleasure.
We'll see you next time.